Hey, Alphanurses, I'm Licensure from alphanurseguy.com. This is 30 practice NCLEX questions. Without delay, let's get started.
A client has been admitted to the medical surgical unit following an emergency cholecystectomy. There is a Jackson Pratt drain with a portable suction unit attached. After 4 hours, the drainage unit is full. The nurse should do which of the following? 1. Notify the surgeon. 2. Remove the drain and suction unit. 3. Check the dressing for bleeding. 4. Empty the drainage unit. The correct answer is 4. Empty the drainage unit. Portable suction units should be emptied and drained every shift or when full. It is normal for the unit to fill within the first hours after surgery. The nurse does not need to contact the surgeon. There should not be bleeding on the dressing if the drainage system is emptied when full. The drain should not be removed until prescribed by the physician. The client who has been hospitalized with pancreatitis does not drink alcohol because of her religious convictions. She becomes upset when the physician persists in asking her about alcohol intake. The nurse should explain that the reason for these questions is that 1. There is a strong link between alcohol use and acute pancreatitis. 2. Alcohol intake can interfere with the tests used to diagnose pancreatitis. 3. Alcoholism is a major health problem, and all clients are questioned about alcohol intake. 4. The physician must obtain the pertinent facts, regardless of religious beliefs. The correct answer is 1. There is a strong link between alcohol use and acute pancreatitis. Alcoholism is a major cause of acute pancreatitis in the United States and Canada. Because some clients are reluctant to discuss alcohol use, staff may inquire about it in several ways. Generally, alcohol intake does not interfere with the tests used to diagnose pancreatitis. Recent ingestion of large amounts of alcohol, however, may cause an increased serum amylase level. Large amounts of ethyl and methyl alcohol may produce an elevated urinary amylase concentration. All clients are asked about alcohol and drug use on hospital admission, but this information is especially pertinent for clients with pancreatitis. Physicians do need to seek facts, but this can be done while respecting the client's religious beliefs. Respecting religious beliefs is important in providing holistic client care. The nurse monitors the client with pancreatitis for early signs of shock. Which of the following conditions is primarily responsible for making it difficult to manage shock in pancreatitis? 1. Severity of intestinal hemorrhage. 2. Vasodilating effects of kinin peptides. 3. Tendency toward heart failure. 4. Frequent incidence of acute tubular necrosis. The correct answer is 2. Vasodilating effects of kinin peptides. Life-threatening shock is a potential complication of pancreatitis. Kinin peptides activated by the trap trypsin cause vasodilation and increased capillary permeability. These effects exacerbate shock and are not easily reversed with pharmacologic agents such as vasopressors. Hemorrhage may occur into the pancreas, but not in the intestines. Systemic complications include pulmonary complications, but not heart failure or acute tubular necrosis.
The monitor technician informs the nurse that the client has started having premature ventricular contractions every other beat, which is a priority nursing action. 1. Activate the rapid response team. 2. Assess the client's orientation and vital signs. 3. Call the physician. 4. Administer a bolus of lidocaine. The correct answer is 2. The priority action is to assess the client and determine whether the rhythm is life-threatening. More information, including vital signs, should be obtained, and the physician should be quickly notified. A bolus of lidocaine may be prescribed to treat this arrhythmia. This is not a code-type situation unless the client has been determined to be in a life-threatening situation.
A client is admitted with acute necrotizing pancreatitis. Lab results have been obtained, and a peripheral IV has been inserted. Which of the following prescriptions from a healthcare provider should the nurse question? 1. Infuse a 500 ml normal saline bolus. 2. Calcium gluconate 90 mg in 100 ml normal saline. 3. Total parenteral nutrition at 72 ml per hour. 4. Placement of a Foley catheter. The correct answer is 3. Total parenteral nutrition at 72 ml per hour. Clients with acute necrotizing pancreatitis should remain nothing by mouth with early enteral feeding via the jejunum to maintain bowel integrity and immune function. TPN is considered if enteral feedings are contraindicated. Access is also needed for TPN, preferably via a central line. Hemodynamic instability can result from fluid volume loss and bleeding and requires fluid and electrolyte replacement. Fat necrosis occurring with acute pancreatitis can cause hypocalcemia requiring calcium replacement. A Foley catheter provides accurate output assessment to monitor for prerenal acute renal failure that can occur from hypovolemia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. What can an electrocardiogram detect? Select all that apply. 1. Ischemia. 2. Injury. 3. Cardiac output. 4. Dysrhythmias. 5. Systemic vascular resistance. 6. Occlusion pressure. 7. Conduction delay. The correct answers are 1. Ischemia. 2. Injury. 4. Dysrhythmias. 7. Conduction delay. An electrocardiogram can indicate ischemia of the heart muscle. An electrocardiogram can indicate injury to the heart muscle. An electrocardiogram can show dysrhythmias. An electrocardiogram does show conduction delays. An electrocardiogram does not indicate cardiac output. An electrocardiogram does not show systemic vascular resistance. An electrocardiogram does not show occlusion pressures. The electrocardiogram checks the electrical system of the heart, not the mechanical system. Cardiac output is mechanical. Occlusion pressure does not have to do with the electrocardiogram, and systemic vascular resistance measures pressures in the peripheral system. Which intervention should the nurse implement when administering epoetin subcutaneously? Select all that apply. 1. Do not shake the vial prior to preparing the injection. 2. Apply a warm washcloth after administering the medication. 3. Discard any unused portion of the vial after pulling up the correct dose. 4. Keep the medication vials in the refrigerator until preparing to administer. 5. Administer the medication intramuscularly in the deltoid muscle. The correct answers are 1. Do not shake the vial prior to preparing the injection. 3. Discard any unused portion of the vial after pulling up the correct dose. And 4. Keep the medication vials in the refrigerator until preparing to administer. Do not shake the vial because shaking may denature the biological response modifier, epoetin, rendering it biologically inactive. The nurse should only use the vial for one dose. The nurse should not re-access the vial and should discard any unused portion because the vial contains no preservatives. The medication should be stored in the refrigerator and should be warmed to room temperature prior to its being administered. The nurse should apply ice to numb the injection site, not a warm washcloth after administration. This injection is administered subcutaneously, not intramuscularly. Which client would the nurse identify as being most at risk for experiencing a CVA? 1. A 55-year-old African American male. 2. An 84-year-old Japanese female. 3. A 67-year-old Caucasian male. 4. A 39-year-old pregnant female. The correct answer is 1. A 55-year-old African American male. African Americans have twice the rate of CVAs as Caucasians, and men have a higher incidence than women. African Americans suffer more extensive damage from a CVA than do people of other cultural groups. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm on the monitor. See the electrocardiogram strip below. The nurse should 1. Notify the physician. 2. Call the rapid response team. 3. Assess the client for changes in the rhythm. 4. Administer lidocaine as prescribed. The correct answer is 3. Assess the client for changes in the rhythm. The client is experiencing a single PVC. PVCs are characterized by a QRS of longer than 0.12 second and by a wide, notched, or slurred QRS complex. There is no P wave related to the QRS complex, and the T wave is usually inverted. PVCs are potentially serious and can lead to ventricular fibrillation or cardiac arrest when they occur more than 6 to 10 in an hour in clients with myocardial infarction. The nurse should continue to monitor the client and note if the PVCs are increasing. It is not necessary to notify the physician or call the rapid response team at this point. Lidocaine is not indicated from the data on this ECG.
Amoxicillin trihydrate 300 milligrams PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 milligrams per 5 milliliters. How many milliliters should the nurse administer? Blank ml. The correct answer is 6 milliliters. The formula is 300 milligrams over X ml equal to 250 milligrams over 5 milliliters. You cross multiply and get 250X equals to 1500. You divide by 250 on both sides and you get 6 milliliters. A 10-year-old child who is 5'4" tall with a history of asthma uses an inhaled bronchodilator only when needed. She takes no other medications routinely. Her best peak expiratory flow rate is 270 liters per minute. The child's current peak flow reading is 180 liters per minute. The nurse interprets this reading as indicating which of the following? 1. The child's asthma is under good control, so the routine treatment plan should continue. 2. The child needs to use her short-acting inhaled beta-2 agonist medication. 3. This is a medical emergency requiring a trip to the emergency department for treatment. 4. The child needs to use her inhaled cromolyn sodium. The correct answer is 2. The peak flow of 180 liters per minute is in the yellow zone, or 50% to 80% of the child's personal best. This means that the child's asthma is not well controlled, thereby necessitating the use of a short-acting beta-2 agonist medication to relieve the bronchospasm. A peak flow reading greater than 80% of the child's personal best would indicate that the child's asthma is in the green zone or under good control. A peak flow reading in the red zone, or less than 50% of the child's personal best, would require notification of the healthcare provider or a trip to the emergency department. Cromolyn sodium is not used for short-term treatment of acute bronchospasm. It is used as part of a long-term therapy regimen to help desensitize mast cells and thereby help to prevent symptoms. A client is scheduled for the insertion of an implantable cardioverter defibrillator, ICD. The spouse expresses anxiety about what would happen if the device discharges during physical contact. The nurse should tell the spouse, 1. Physical contact should be avoided whenever possible. 2. They will not feel the countershock. 3. The shock will be felt, but it would not cause any harm. 4. A warning device sounds before countershock, so there is time to move away. The correct answer is 4. An implanted defibrillator always provides at least 3 beeps before delivering a countershock, and the nurse should tell the spouse to move away when they hear those beeps. The spouse can have physical contact with the client, but if the ICD were to discharge while the spouse had contact with the client, the spouse would feel the shock and could also be harmed. The spouse will feel the countershock if touching the client, and it would harm the spouse.
The nurse should teach the client with Graves' disease to prevent corneal irritation from mild exophthalmos by 1. Massaging the eyes at regular intervals. 2. Instilling an ophthalmic anesthetic as prescribed. 3. Wearing dark-colored glasses. 4. Covering both eyes with moistened gauze pads. The correct answer is 3. Wearing dark-colored glasses. Treatment of mild ophthalmopathy that may accompany thyrotoxicosis includes measures such as wearing sunglasses to protect the eyes from corneal irritation. Treatment of ophthalmopathy should be performed in consultation with an ophthalmologist. Massaging the eyes will not help to protect the cornea. An ophthalmic anesthetic is used to examine and possibly treat a painful eye, not protect the cornea. Covering the eyes with moist gauze pads is not a satisfactory nursing measure to protect the eyes of a client with exophthalmos because treatment is not focused on moisture to the eye, but rather on protecting the cornea and optic nerve. In exophthalmos, the retrobulbar connective tissues and extraocular muscle volume are expanded because of fluid retention. The pressure is also increased. The nurse notices that a client's heart rate decreases from 63 to 50 beats per minute on the monitor. The nurse should first 1. Administer atropine 0.5 mg IV push. 2. Auscultate for abnormal heart sounds. 3. Prepare for transcutaneous pacing. 4. Take the client's blood pressure. The correct answer is 4. Take the client's blood pressure. The nurse should first assess the client's tolerance to the drop in heart rate by checking the blood pressure and level of consciousness and determine if atropine is needed. If the client is symptomatic, atropine and transcutaneous pacing are interventions for symptomatic bradycardia. Once the client is stable, further physical assessments can be done. The nurse is caring for a patient in labor at 39 weeks gestation and has identified mild variable fetal heart rate decelerations. Which action would the nurse take first? 1. Change the maternal position. 2. Notify the healthcare provider. 3. Prepare for delivery. 4. Readjust the fetal monitor. The correct answer is 1. Change the maternal position. The cause of variable fetal heart decelerations is compression of the umbilical cord, which can often be corrected by a change in maternal position. It is usually a benign condition and would not require the nurse to prepare for delivery or to notify the healthcare provider unless the variable decelerations are severe and persistent. Adjusting the fetal monitor may be needed after the change in maternal position, but would not directly address the variable decelerations. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A 16-year-old client is prescribed 10 milligrams of paroxetine at bedtime for major depression. The nurse should instruct the client and parents to monitor the client closely for which adverse effect? 1. Headache. 2. Nausea. 3. Fatigue. 4. Agitation. The correct answer is 4. Agitation. Rationale. The nurse closely monitors the client taking paroxetine for the development of agitation, which could lead to a self-deletion attempt. Headache, nausea, and fatigue are transient adverse effects of paroxetine.
For the child with hypoplastic left heart syndrome, which drug may be given to allow the patent ductus arteriosus to remain open until surgery? Blank. The correct answer is prostaglandin E. Prostaglandin E maintains ductal patency to promote blood flow until the Norwood procedure is begun. Consider the opposite of wanting to close the patent ductus arteriosus. A client diagnosed with a subarachnoid hemorrhage has undergone a craniotomy for repair of a ruptured aneurysm. Which intervention will the intensive care nurse implement? 1. Administer a stool softener, BID. 2. Encourage the client to cough hourly. 3. Monitor neurological status every shift. 4. Maintain the dopamine drip to keep blood pressure at 160/90. The correct answer is 1. Administer a stool softener, BID. The client is at risk for increased intracranial pressure whenever performing the Valsalva maneuver, which will occur when straining during defecation. Therefore, stool softeners would be appropriate. The client diagnosed with a mild concussion is being discharged from the emergency department. Which discharge instruction should the nurse teach the client's significant other? 1. Awaken the client every 2 hours. 2. Monitor for increased intracranial pressure. 3. Observe frequently for hypervigilance. 4. Offer the client food every 3 to 4 hours. The correct answer is 1. Awaken the client every 2 hours. Awakening the client every 2 hours allows the identification of headache, dizziness, lethargy, irritability, and anxiety, all signs of post-concussion syndrome that would warrant the significant others taking the client back to the emergency department. The resident in a long-term care facility fell during the previous shift and has a laceration in the occipital area that has been closed with steri-strips. Which signs/symptoms would warrant transferring the resident to the emergency department? 1. A 4 centimeters area of bright red drainage on the dressing. 2. A weak pulse, shallow respirations, and cool, pale skin. 3. Pupils that are equal, react to light, and accommodate. 4. Complaints of a headache that resolves with medication. The correct answer is 2. A weak pulse, shallow respirations, and cool, pale skin. These signs, symptoms, weak pulse, shallow respirations, cool, pale skin, indicate increased intracranial pressure from cerebral edema secondary to the fall, and they require immediate attention. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is caring for the following clients. Which client would the nurse assess first after receiving the shift report? 1. The 22-year-old male client diagnosed with a concussion who is complaining someone is waking him up every 2 hours. 2. The 36-year-old female client admitted with complaints of left-sided weakness who is scheduled for a magnetic resonance imaging scan. 3. The 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. 4. The 62-year-old client diagnosed with a cerebrovascular accident who has expressive aphasia. The correct answer is 3. The 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. The Glasgow Coma Scale is used to determine a client's response to stimuli, eye-opening response, best verbal response, and best motor response, secondary to a neurological problem. Scores range from 3 to 15. The client with a head injury is experiencing increased intracranial pressure. The neurosurgeon prescribes mannitol. Which intervention should the nurse implement when administering this medication? 1. Monitor the client's arterial blood gases during administration. 2. Do not administer if the client's blood pressure is less than 90/60. 3. Ensure that the client's cardiac status is monitored by telemetry. 4. Use a filter needle when administering the medication. The correct answer is 4. Use a filter needle when administering the medication. The nurse must use a filter needle when administering the osmotic diuretic mannitol because crystals may form in the solution and syringe and be inadvertently injected into the client if a filter needle is not used. The client with increased intracranial pressure is receiving mannitol. Which data would cause the nurse to hold the administration of this medication? 1. The serum osmolality is 330 milliosmoles per kilogram. 2. The urine osmolality is 550 milliosmoles per kilogram. 3. The blood urea nitrogen level is 8 milligrams per deciliter. 4. The creatinine level is 1.8 milligrams per deciliter. The correct answer is 1. The serum osmolality is 330 milliosmoles per kilogram. The normal serum osmolality is 275 to 300 milliosmoles per kilogram. The osmotic diuretic mannitol is held if the serum osmolality exceeds 310 to 320 milliosmoles per kilogram. Which discharge instructions should the emergency room nurse discuss with the client who has sustained a concussion? Select all that apply. 1. Do not drink any type of alcoholic beverage until allowed by the HCP. 2. Take 2 acetaminophen up to every 6 hours for a headache. 3. If experiencing a headache, take 1 hydrocodone every 8 hours. 4. It is all right to take a couple of aspirin if experiencing a headache. 5. Notify the HCP if the medication does not relieve your headache. The correct answers are 1. Do not drink any type of alcoholic beverage until allowed by the HCP. 2. Take 2 acetaminophen up to every 6 hours for a headache. And 5. Notify the HCP if the medication does not relieve your headache. Traumatic brain injuries can impair many brain functions that can be significantly worsened by alcohol, so the client should not drink alcoholic beverages until allowed by the HCP. Acetaminophen, a non-narcotic analgesic, can be taken for a headache in a patient who has sustained a concussion. If acetaminophen does not relieve the client's headache, then the client should notify the HCP because this may indicate a worsening condition, such as increased intracranial pressure. The following clients have a head injury. Which clients should the nurse question administering the medication mannitol? Select all that apply. 1. The 34-year-old client who is HIV positive. 2. The 84-year-old client who has glaucoma. 3. The 68-year-old client who has cor pulmonale. 4. The 16-year-old client who has cystic fibrosis. 5. The 58-year-old client with congestive heart failure. The correct answers are 3. The 68-year-old client who has cor pulmonale, and 5. The 58-year-old client with congestive heart failure. Cor pulmonale is right-sided heart failure, often secondary to chronic obstructive pulmonary disease. Because mannitol pulls fluid off the brain, it may lead to a circulatory overload, which the heart with right-sided failure could not handle. This client would need an order for a loop diuretic to prevent serious cardiac complications. Because the osmotic diuretic mannitol pulls fluid off the brain, it may lead to a circulatory overload, which the client in CHF could not handle. This client would need an order for a loop diuretic to prevent serious cardiac complications. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client has an open laceration on the right temporal lobe secondary to being hit on the head with a baseball bat. The emergency department's HCP sutures the laceration, and the CT scan is negative. Which instruction should the nurse discuss with the client? 1. Do not put anything on the laceration for 72 hours. 2. Use hydrocortisone cream 0.5% on the laceration. 3. Cleanse the area with alcohol 3 times a day. 4. Apply a topical antibiotic ointment to the sutured area. The correct answer is 4. Apply a topical antibiotic ointment to the sutured area. The sutured area must be cleansed with soap and water and patted dry, and an antibiotic ointment, such as Neosporin, should be applied to prevent infection. The client with a head injury is ordered a CT scan of the head with contrast dye. Which statements by the client warrant immediate intervention? Select all that apply. 1. I take atenolol for my high blood pressure. 2. I am allergic to many types of fish. 3. I get nauseated whenever I take aspirin. 4. I am taking metformin for my diabetes. 5. I had about 3 beers before I fell and hit my head. The correct answers are 2. I am allergic to many types of fish, and 4. I am taking metformin for my diabetes. The contrast dye used in a CT scan is iodine-based, and an allergy to shellfish suggests an allergy to iodine and would warrant the nurse notifying the HCP to cancel the contrast part of the CT scan. Further assessment would be needed. Metformin, a biguanide medication used for control of diabetes, must not be taken because the kidneys remove metformin. Contrast medium can greatly increase the level of metformin in the blood because damaged kidneys are not as effective at removing metformin from the body. The nurse is preparing to administer medications to the following clients. Which medication should the nurse question administering? 1. Furosemide to a client with a serum potassium level of 4.2 milliequivalents per liter. 2. Mannitol to a client with a serum osmolality of 280 milliosmol per kilogram. 3. Digoxin to a client with a digoxin level of 2.4 nanograms per milliliter. 4. Phenytoin to a client with a phenytoin level of 14 microgram per milliliter. The correct answer is 3. Digoxin to a client with a digoxin level of 2.4 nanograms per milliliter. The normal digoxin level is 0.8 to 2.0 nanograms per milliliter. A digoxin level of 2.4 nanograms per milliliter would warrant the nurse questioning the administration of this medication. The trade name for digoxin is Lanoxin, and the classification is cardiac glycoside. The client with a head injury is admitted into the intensive care unit. Which HCP medication order should the ICU nurse question? Select all that apply. 1. Morphine. 2. Mannitol. 3. Methylprednisolone. 4. Phenytoin. 5. Oxygen. The correct answers are 1. Morphine and 3. Methylprednisolone. Administering narcotics to clients with head injuries may mask signs of increased intracranial pressure, so the nurse questioning this medication would be appropriate. Research supports the finding that clients with head injuries who are treated with anti-inflammatory corticosteroids are 20% more likely to die within 2 weeks after the head injury than those who aren't treated. The nurse should question this medication. The client with increased intracranial pressure is receiving mannitol. Which intervention should the nurse implement to evaluate the effectiveness of the medication? 1. Monitor the client's vital signs. 2. Maintain strict intake and output. 3. Assess the client's neurological status. 4. Check the client's serum osmolality level. The correct answer is 3. Assess the client's neurological status. Mannitol, an osmotic diuretic, is administered to decrease intracranial pressure. Changes in intracranial pressure affect neurological status. Therefore, the client's neurological status should be evaluated to determine the effectiveness of the medication. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.